have the doctor from the cool hills of Mandeville, and I must tell you that he's looking quite cool today. Yes, I hope it's still cool in Mandeville. You want to see him decked out in his colorful shirt. I hope things bright are happening today. I hope no emergency like last week. But when it comes to a doctor, you never can tell.
I'm
Today
telling
is
you.
fine. Tomorrow is an emergency. I said tomorrow, I
Yes,
mean next minute.
exactly. I mean, it's unpredictable, just like the weather. You think you know everything, and you think you could plan for your day, but out of the blue, the weather pattern changes. So
Yes. And we had
that's
a
how it is.
meteorologist yesterday,
Right,
Rowan
right,
Brown.
right.
Mhm.
Okay, that's very interesting. Very, very interesting. So how you doing, Vernon?
Well, I continue to fight the good fight, but
Right,
nothing physical hurting now, so I can still
wonderful.
smile and full of energy same way.
Right, that's wonderful. That's
Mhm.
wonderful. That's wonderful.
And for
Yes,
my
Vernon.
listeners who don't know, we are talking in codes. But those who
Yes,
know, they know what's happening.
exactly,
Yes,
Vernon. Right. Yes, Vernon. I would just like to say hello to you and the staff,
yes.
and also to your followers and listeners as well. Um, right. You see, Vernon, I want to share something with you.
Yes.
Last week in my office, I saw this female. She's in her early 40s,
Hmm.
and she has been presenting to me some vague symptoms. One was that she sometimes feel as though she's quite irritable, especially towards her husband. Sometimes she expresses to me that she tends to be forgetful
Oh
and
my
so forth.
God. Yes, yes.
Right.
What if it's menopause?
Uh, oh, geez, Vernon. There you go. Right on the head.
But if I talk to you
Right on the
doctors
head.
all the while, you don't expect me to pick up.
Right on the head. Right on the head. And
Yes,
and you see, Vernon, this is something that I think we need to talk about. This is something
yes,
that is um s- discussed in very little detail.
yes.
And I honestly think that more research needs to be done in this area.
And I must
Because
interject here. I think they need to take the men out of it. Everything bad about women or challenge, they put men in front. I don't like it.
exactly. That, even for that, research needs to be done as well.
Exactly, exactly.
Right, right. And Vernon, it's sad because really and truly, um half the population, at least half the population, are
Yes.
females. And at some point in their lives, as
Hmm.
long as they live through at least as long as they go through the natural course of life, they will at some point reach that landmark in their development.
Hmm.
And menopause affects women who are in their middle ages. That is when it tends to occur. And menopause is basically a period in a woman's cycle, where she stops producing eggs, and she stops menstruating. And this is as a
Hmm.
result of the reduction in her hormones or sex hormones, mainly
Yes.
estrogen. And so this can happen anywhere between the ages of 45, 50, even up to 55. But the median onset is around age 51.
Hmm. Hmm.
Menopause is really not seeing a period for about 12 months
Oh,
following the last time she saw a period.
yes,
So if
yes,
it is you stop seeing a period in January of this year,
yes,
and June comes around, still no period, and then August comes around, no period, and September comes around and you're seeing your period, you still have not entered menopause,
but
right?
what would cause
So
that, doc?
I mean, that means it's still not yet menopause. You're just
But
going
why
through
would
what
a
we call the
woman miss her menstruation
period
for 2, 3, or for
for so
yes,
long. It is totally not understood, but we know that it has to do with the falling or fluctuating levels of our hormones, because
okay.
it's gradually decreasing, and then for
Hmm.
some reason it may spike up a little bit, and then cause a period and go back down. So we may have a fluctuation while it is being reduced until there is a flat line, so to speak, where you have total
Mhm.
reduction in the production of these hormones, and as a
Yes.
result of that, it's not until we reach 12 months after your last period
Mhm.
and categorically say that you have entered menopause. Now, before you start, or before the individual actually
Mhm.
goes into that period, there's that phase we call perimenopause. And perimenopause is really the age at which the hormones have started to decline.
Mhm.
And as a result of that, that individual tends to undergo a number of symptoms.
Yes.
And this period of perimenopause or even menopause can last, or the symptoms I should say, can last anywhere for a couple of months up to a couple of years. And these couple of years can be 5 years, it can even stretch to 10 years. Some have even gone to 15, 20 years of
Really?
experiencing the same symptoms. And so there are a few things we need to understand as well. Now, as I said, the typical age at which we start having these cessations is around 45. And if it is that it occurs before 40, we call that premature menstruation. And this can be as a result, if it is as a result of surgery, or any kind of chemical, um, I wouldn't say castration, but if chemicals are undergone that affects with the ovarian function, mainly
Right.
persons who are undergoing chemotherapy,
Mhm.
this can induce early or premature menopause.
Mhm.
If it is that the person has not undergone any physical or structural changes, mainly in the form of surgery. If there's no surgery to remove our ovaries, or there's no um, chemicals involved, we call that a primary ovarian insufficiency. All right, and this
Mhm.
occurs in a very small portion of the population. All right, so that is what tends to happen if it is that the individual starts experiencing these menopausal symptoms before 40 years old.
All right.
No,
Hold that point. We're going to go for the break. When we come back, we continue from there. And what I want to get into, if we have time, is to tell me how it can
right.
affect your relationships. Because I
We're
think I have an idea. All right. We're talking to Dr. Llewellyn Johnson, the cool doctor from the cool hills of Mandeville, the man with a heart who loves people. Brother Darby, this is spot on. Stay with us. We'll come back. Welcome back. You're listening to Spot On with Vernon Darby, coming to you live from Kingston, Jamaica. It is your health, your wealth, and our very special guest is Dr. Llewellyn Johnson. And he has been talking about menopause. I've been pushing for them to, everything, every time the ladies have a challenge, we put men in front of it. Um, except when we call them, we say women, and they put men at the end. But so we say women. I don't know why they put the men at the end. But Dr. Llewellyn Johnson is back with us, my brother. I was just
right,
talking about women and some men who say women. Right, we're talking about menopause.
right, right.
Yes.
Yes, Vernon. So, as I said before, there is a period that preludes the menopausal phase, and
Right.
as I said, this is what we call the perimenopausal phase, and
Mhm.
these are some symptoms that tend to be accompanied in that phase, where in the life of that woman, because of the declining in her hormonal levels, we start seeing physical changes. We start even she's starting to experience emotional and even psychiatric changes as well. And Vernon, the usual symptoms tend to be hot flashes, a bit of
Hot
irritability.
flashes?
Yes,
What
hot
is that?
flashes. It's a vasomotor symptom, meaning that it has to do with how your body, at least for an unregulated um, form or sensation of heat, even though the ambient temperature or the surrounding temperature may be cool. And that individual tends to have this feeling of her body being engulfed in heat.
Okay.
And no matter the amount of fan that is blown on her, or even she's in an AC, she may still be even asking for it to be turned on even further, right? And this may be accompanied with night sweats, um, and sometimes the individual, as time progresses, the her
Mm.
periods also changes as well, where it become maybe from frequent to infrequent. It may become longer, or it may become shorter, or it may have an increased amount of shedding, or small amount of bleeding. So all of these things tend to be accompanied during this phase. Now, there are some persons who are going through the changes,
Mm.
and the changes vary from individual to individual. For some women, Vernon, these women may experience an what do we call now, unexplainable sensation in the skin, where it feels as though ants are crawling in their skin, you
Really?
know and this yes, this has been reported, and there has been dialogues with different females along the globe, and
Yes.
for years they have been going to their practitioners and not understand that these are what tends to happen even during their
Mm.
menopausal or perimenopausal phase, because it's so vague.
Mm.
It tends to be dismissed, and despite blood studies, you will not be able to identify any change within the in the normal chemistry of the blood. And so
Yes.
it's really going off these symptoms that you kind of pinpoint and make the connections to
Mm.
identify to that individual, especially at that age group, that it could be that they're going through menopause, or they're approaching that period. Now, um Vernon, the other thing too is that as there's a decline in the hormones, there's going to be a decline also in the sex drive. We call it the libido. And so
Mm.
men and women, especially if they're within the similar age group, remember, men's testosterone tends not to decline as fast as women. And so
Right.
while there is an increase or maintenance level of the testosterone in the males, the women have a reverse effect, where there's a decline in that amount. So the taste for sex is going to be diminished, right? And the vaginal vault will also undergo changes. It will not be as elastic and thick as before. It
Mm.
becomes a bit dry as well. So even if they do engage in sexual intercourse, it will not be very pleasurable to the woman. All right. And this in
All right.
itself,
As you
Vernon,
mentioned
going
that
to the
point,
postnatal.
so I hope the men
Mm-hmm.
are listening, and I'm going to make sure I get these things distributed, because sometimes the men, they don't understand.
No,
They
no,
don't
they don't
understand the
understand.
woman at all. And then
Mm-hmm.
they will jump to conclusion and say, a man she have a road,
Exactly.
right?
Exactly. And
And if the
right.
woman not interested in do what they normally do, that's another story. And
That's
then
another story.
abuse might come into play.
Yes.
I want to know the boss. I
Yes.
don't feel listen to them program and learn, because I know no don't know want to behave like that. I don't get kind of what I say no ignorant. And you're ignorant
Yes.
because you are ignorant of these things.
Exactly, Vernon. So
Yeah.
the poor lady is going
I
through
hope you
a
know the two
change that
meanings of the word, doc. Ignorant. Jamaicans
I
giving
know
you two
it
meanings.
it it is it is a sword that has a two-edged there. So we know what
Yes,
it we
yes,
definitely know what it means there. So
yes.
so Vernon, so we see how it is that this it is a normal this is what we call physiological. That means it is normal. These changes are normal. And for
Mm,
some persons or some authors, what they say, it's basically a reverse of what you would experience when in puberty. Remember, there
mm,
is a period before you start producing hormones, or especially for females, there's a period before you start having your period. as like
Yes.
you're reverting into that stage in your life where you're not having any more periods. And
Mhm.
so these are some of the changes that tends to occur. And sometimes women may find themselves going to the bathroom more frequently than before. And it's not that they have a urinary tract infection, it's just that the
Okay.
elasticity around the bladder becomes weak, so they can't hold the amount of urine that they would normally would be able to do to hold prior to that stage in their life. And
Mhm.
so the poor lady, especially if they have meetings, you would see them shuffling in their seats, because the urge of urinating is so much. And so you don't be surprised if you see them going to the bathroom more frequently than before.
Yes, yes.
And these are some of the changes that we have to be aware of as males as well, when we see these things happening to women, especially when they reach their mid 40s, or the
Dr.
mid
Johnson,
their.
that asking, a
Mhm.
lot of abuse in homes is caused by because men do not understand. So when
Yes.
that woman starts to behave in a particular way, well, the first thing some of them do is start to go on the road. And that
Yeah.
could be the end of the end.
Right.
And
But
then they
but to be
start the abuse.
yes, but to be honest with you, Vernon,
Ye-
it goes beyond the relationship between the man and the woman.
Yes.
The relationship between the woman and the rest of society can evolve as well, because there
Okay.
is because there is a tight relationship between the brain function and the reproductive organs of the woman. it's
I
it's a
see.
it's a neuroendocrine relationship where the brain communicates with the ovaries communicate with the brain
Hmm.
as well, right? And so there is a theory that supports the fact that um estrogen um, is responsible for metabolism,
Hmm.
or for energy of the brain. And so, when there's more energy, the brain functions better. But when there's less energy, the function of the brain declines as well. And so,
Yes.
between the perimenopausal phase, or should I say before menopause and after menopause, there is a 30% decline in the energy production of the brain. And because of this decline, Vernon, we realize that women tend to, well, we see a correlation between women entering into a phase where at this point that they observe a 50% increase over their male counterpart in developing Alzheimer's, because the reduction in the estrogen level tends to, it's we're not certain if it helps in the speeding up of what we call the plaque amyloid particles in the brain that helps in the formation of dementia. But
Yes.
we also notice that these women tends to go into a period of depression and anxiety, right? And so, people may be wondering, why is it that Jane just behaves so strange nowadays, and not knowing and not understanding it's really because of the decline or this fluctuation in estrogen. And some people, Vernon, may
Hmm.
even start hearing voices, and you're thinking that
What?
person has become um have become
Schizophrenic or what do
no,
you call the word? That's
schizophrenic.
schizophrenic. Yeah. Yes.
Yes, right? Become delusional or hallucinating.
Right.
Right. So these are some of the changes definitely that can occur when you're going through, because as I said, the estrogen is what helps to give energy to the brain. And
Hmm.
there are certain functions of the brain, or certain parts of the brain
Hmm.
that's specific for certain activities. For example, the hippocampus or the hypothalamus. The hypothalamus is what is responsible for body temperature regulation. So if you have a reduction in the energy of that part of the brain to regulate the temperature of the body,
Hmm.
maybe though that is why you have these women enter into hot flashes, especially, and even though it's cold, the body cannot regulate itself properly, right? The other thing is that it affects the brainstem as well, and the brainstem, a part of its function is to control your sleep. And so women at this time will experience periods of what we call insomnia. They are unable to keep or have a good quality of sleep, or the sleep
Hmm.
is very short, right?
That will
Another
make
thing
them
that we
probably
do,
get moody.
and oh, hold on now, there's a part of the brain we call the amygdala that is responsible for your emotions. And so as a result of that, now you're going to have changes in the mood of that
Mm-hmm.
individual. All right. And even what we call the hippocampus. The hippocampus is what is responsible for memory and memory consolidation. So don't be surprised when your sister, your wife, your friend, your colleague is experiencing or demonstrating these gradual but certain changes. You
We
know,
have
you
another
have a
minute left,
meeting and
Doc.
you right, and you say that, boy, we discussed this just a while ago, and she would tell you, no, we didn't. And these are things that we have to look forward to. And sometimes, Verna, this caused some of our women to feel so unproductive, and cause them to have low self esteem after a while, and
Mm.
sometimes they exit their jobs quite early, and have
Oh.
early go, and some women go on pre retirement
Mm-hmm.
leave, right, because of the stigma associated, not with the fact that they know that they're going through menopause. It's just that they think that they're not as sharp and as focused as before,
Mm-hmm.
and tends to reduce their quality of production. So, as I said, Vernon, this is something that we definitely need to understand more. More research needs to be added to this part of human physiology, because I said it is not an abnormality. It's something that happens in every woman's life cycle.
And Doc, I will tell you, when you go to school, you learn the physics and the chemistry and the mathematics and all these subjects.
Mhm.
We learn how to be employed by someone.
Right,
But it's time we
right.
start to learn more how to get along with one another. Because I'm telling you, Doc, many problems
Mm-hmm.
have been caused in the home because of menopause. And women, when you learn something, you need to share it with the man before it starts. Share it with him
Yeah,
and tell him what is going on. Because sometimes
right.
when men function, so we cuss them off, when they start go road, we're saying worthless and what have you. But these things do
Mm-hmm.
happen. If people understand themselves, they will not do it. Because let me tell you something, when you have a faithful woman and she's going through that
Right.
process and you stick with her, the young girl, the wanna look something. So stay there. That's a
Yeah.
professional advice. That's giving my opinion, Doc.
But remember too, those young girls at some point in their lifetime will go through that same phase.
Ah!
So it's
But
just
by that
a matter
time,
of time.
you'd have departed this
It's just a
earth
matter of time.
and they would have inherited everything.
Hmm.
Those who have ears to
Exactly.
hear, let them hear.
Exactly.
Doc, tell us how to make contact
Mhm.
with you.
Yes, Vernon. Thank you so very much. I'm located at 14 Caledonia Road at Consolidated Health Service in Mandeville. Telephone numbers include 589-0608 or 791-1090. Email contact Llewellyn Johnson, Llewyn Johnson at hotmail.com.
Next week, you probably have to go over this topic and go into more details because I'm telling you, even Pastor Boyd is saying the same thing that I'm saying. It's amazing. So let me see
Mm.
now. Women, what do you call it again? Menopause. So when
Right,
I wonder if the
menopause.
men have a similar thing. I wonder if you call for the men now. Would you call it women and menopause? Same thing, they know me tongue tie.
Andro- well, andropause.
Andropause. So I got to make up there
Yes,
when
men
there's a medical term
andropause.
for it. Andropause. All right. Doc, next time we have to look at it. All right. Thank you very much, Dr. Llewellyn John.